So good morning, everybody. I guess we'll start. It's a pleasure to be here in New York City. And I'd like to welcome you all here for this discussion of the Roundtable on Population Health Improvement. I'm co-chair of the, I'm Dr. George Isham, and I'm co-chair of the Institute of Medicine Roundtable on Population Health Improvement. And in addition to welcoming our roundtable members, I'm particularly delighted to welcome our esteemed speakers and those of you who have taken the trouble to be with us and share with us your expertise on this really very important topic. I want to let everybody know that this meeting is being recorded and webcast. So we have a pretty good little group here in the auditorium, but hopefully we have many, many more who will be watching on the web and listening on the web. And not only today as we have it live, but as this webcast is archived and accessible to a larger audience asynchronously over time. So that's a very important aspect of what we do, is not only have the conversation and the dialogue in person here, both with people here and over the web, but it's accessible to people over time. If you have any questions about the logistical aspects of the meeting, the IOM staff, headed up by Alina Bachu, is wearing green name tags, and they can help you with any questions or issues that you may have during the course of the meeting today. Our roundtable on population health improvement provides a trusted venue for leaders from the public and private sectors to meet and discuss the leverage points and opportunities arising from changes in the social and political environment for achieving better population health. That's our purpose. The Roundtable's vision is of a strong, healthful, and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent economic, social, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies and dependable resources to achieve it. So as one of our major activities, this roundtable sponsors workshops for members of the roundtable and sponsors, stakeholders, and the public to discuss issues of importance to improving our nation's health. And as you know, today's workshop will feature presentations and panel discussions on the topic of spread and scale to achieve meaningful population health outcomes. We've identified as a roundtable 6 drivers that we believe shape population health improvement, and that the Roundtable hopes to influence through the ongoing dialogue that catalyzes action among our members and partners. The 6 drivers that we've identified are metrics or measures, resources, relationships, research, policy, and communication. I suspect that the concept of spread and scale intersects with each of these drivers. So I'm going to take a little liberty in terms of acknowledging the fact that I'm no expert in this topic of spread and scale. I look forward to learning from the roundtable discussion today. But prior to any of that learning, I've had a few thoughts about how that intersection of spread and scale might interact with our drivers. So I'm going to offer a couple of comments on that. And then we'll see over the course of the day when I come back and make a comment at the end, as I hope that many of the rest of you will, as we customarily do when we do a little reflection on the days. I'll let you know how my preliminary thinking has been influenced by the experts and those who really know about this topic as we have the discussion over the day. So for example, metrics. To accomplish and improve health across the nation, we may need monitoring of health status at a local and national level and all the levels in between, with the ability to identify both top and low performance and the ability to benchmark nationally and internationally. And as I think about spread and scale, it may apply to setting up good examples of using measurements in communities for improving health or establishing a robust system of measurement of health at the local and national level. So question I have is, how do we accomplish that? How do we get good examples that we have out there of community measurement systems? How do we gain both the scale in terms of spreading the practice, but quite frankly, the scale and scope of a thought out and integrated and detailed enough infrastructure for measurement across the nation? And the resources driver. To accomplish improved health across the nation, we may need additional public and private resources to invest in the social interventions and services that as we at the same time create efficiencies and eliminate waste in healthcare delivery sector that are a drag on our limited total resources for improving health. How do we spread and scale the business case for investment of resources in the public and private sectors? And how do we spread and scale the rationale and interventions that create increased efficiency and the elimination of waste in the healthcare delivery sector? For relationships, to accomplish improved health across the nation, we may need all types of policymakers, health and healthcare leaders, public health officials, philanthropists, academics and researchers, and many others to engage in a scaled up and more vigorous dialogue, discussion, and debate about the necessity to identify approaches and make progress on this topic at a far greater scale and scope than we have to this date. How do we accomplish this? For research, to accomplish improved health across the nation, we may need innovations in policy, interventions, programs, and models and frameworks from our nation's researchers. How do they get from the journals and the conferences to action in the streets in every city and town in the U.S.? For policy, to accomplish improved health across the nation, what federal, state, and local governmental policies that encourage and improve health across the determinants of health are available for spread and scale in all jurisdictions? If the implementation of the ACA is any indication, there are multifaceted regional, political, and economic challenges to be overcome in the scale and spread of effective public policies that address improved health. Additionally, what about private organizations and their roles and policies for their workforces, their policies aimed at the communities in which they do business? And lastly, communication. To accomplish improved health across the nation, how do we actively and effectively use communication to shorten the time of diffusion of good ideas, policies, change public behavior, communicate and the urgency and rationale for change and investment, and recruit and convert many to the cause of improved health in the country? So across these 6 drivers, to accomplish improved health across the nation, we need to think about the spread and scale of at least ideas, values, beliefs, behaviors, policies, and programs. So I, for one, will be listening very carefully to the discussion at today's workshop. I look forward to learning from an excellent group of experts and a well-planned out agenda for this workshop about spread and scale. And I hope you will be listening carefully too. My expectation will be at the end of the day that those of us reflect our thinking about how we apply what we learned today to our task of improving health across the nation, a critical task. So with those few preliminary thoughts, it's my pleasure to introduce Debbie Chang. She is an amazing person in many ways. She is a Vice President of Policy and Prevention at Nemours and co-chairs the committee that planned today's workshop. She's also quite a leader in this field in a number of different ways. You can read her full biography in the materials for this meeting, but it's a pleasure for me to turn the meeting over to Debbie. Debbie?